Hey there, I'm Professor McBride, labor nurse, OB instructor, and your guide to everything OB. Let's get to it.
Presumptive signs are subjective signs. These are things the patient is experiencing that she reports to you. These are things that may make her presume that she is pregnant. The word presumptive has an S in it that reminds us that presumptive signs are subjective. So these could be things like, I missed my period. I've been feeling really tired lately. I need to pee all the time. I've been feeling really sick to my stomach. My breasts feel different. They're kind of tingly and tender, and I feel like the pigment looks different on my areolas. Maybe I'm feeling flutters in my belly. Flutters in our belly could be quickening, which is the first fetal movements that a mom feels. These might feel like butterflies or popping bubbles, and this is something only she can feel and experience. It's not something that we can assess. Typically, this happens around 16 to 20 weeks gestation. So if she is earlier in her pregnancy than that, she may not be experiencing this yet. Probable signs of pregnancy are objective signs. These are things that you can see and assess as the nurse. Probable has an O in it to remind us that probable signs are objective. If she is experiencing these probable signs, she is probably pregnant. Most of these are not going to typically be seen unless she's pregnant. However, there are exceptions. Positive pregnancy test. A positive pregnancy test is detecting HCG in the serum or in the urine. And there are not many opportunities for HCG to be in a woman's body unless she's pregnant. Hegar sign. Hegar sign has to do with softening of the lower uterine segment and is only palpated by a provider. Goodell sign has to do with softening of the cervix, also assessed by a provider. Chadwick sign has to do with discoloration of the cervix and the vagina, a purplish bluish look. Palpable uterine enlargement or Braxton Hicks contractions. If you can palpate her uterus or palpate the tightening of her uterus, she's probably pregnant. However, it's also possible that there are fibroids or tumors in her uterus. We don't know. Ballottement has to do with the rebounding of the fetus when the practitioner puts pressure on the lower uterine segment or the cervix. So the baby or whatever's in the uterus can kind of float up and then come back and rebound back down. That's ballottement. That's also an objective sign. In order for it to count as a positive sign of pregnancy, it has to come from the fetus. So these are things that as the nurse, you can either see, hear, or feel. And it has to be coming specifically from the baby. So ultrasound. Ultrasound, I can see the baby. Also on an x-ray, I can see the baby. These are positive. Dopplers or ultrasound to hear fetal heart tones. If I can hear fetal heart tones, these are positive. If I can palpate or visualize fetal movement, if I can see the baby moving, kicking, I can feel it with my hands, these are also signs that are positive. So let's practice. A client comes to the clinic with amenorrhea and a positive pregnancy test at home. She wants to be sure she's pregnant before she announces her pregnancy. What is the most reliable way to be positive that she is pregnant? Serum HCG pregnancy test in the clinic, ultrasound, Chadwick sign, palpate for uterine enlargement. So HCG pregnancy test is a probable sign. Ultrasound, I can see the fetus. That's a positive sign. Chadwick sign is probable. Palpate for uterine enlargement, also probable. Therefore, The most reliable way to be certain that she is pregnant is going to be the ultrasound. That is the only choice that is a positive sign of pregnancy. A pregnant woman at 10 weeks gestation exhibits the following signs of pregnancy during a routine prenatal checkup. Which ones would be categorized as probable signs of pregnancy? HCG in the urine, breast tenderness, fetal heart sounds, Hegar sign, amenorrhea, and palpable fetal movement. So for this question, let's go back and determine what exactly it's looking for. It says which one would be categorized as probable signs of pregnancy. So let's look at A, HCG in the urine. That's a positive pregnancy test. Is a positive pregnancy test a probable sign of pregnancy? It is. So that's a correct answer. B, breast tenderness. Is breast tenderness a probable sign of pregnancy? Breast tenderness is something your patient reports to you, so it is a presumptive sign. So it's not one of our answers. C, fetal heart sounds. Are fetal heart sounds a probable sign of pregnancy? Fetal heart sounds is coming from the fetus, so it is a positive sign of pregnancy, so it is not an answer here. D, Hegar sign. Is Hegar sign a probable sign of pregnancy? Hegar sign is a probable sign of pregnancy. Remember that any of the ones that have the word sign in it, Hegar sign, Goodell sign, Chadwick sign, those are all probable signs of pregnancy. E, amenorrhea. Amenorrhea is I missed my period. Is that a probable sign of pregnancy? Amenorrhea is presumptive, so it's not a correct choice. F, palpable fetal movement. Is palpable fetal movement a probable sign of pregnancy? Palpable fetal movement is coming from the fetus, therefore it's a positive sign of pregnancy. So our correct answers here are A, the positive pregnancy test, and D, Hegar sign. A client who believes she might be pregnant is discussing symptoms with her nurse. She describes feeling like butterflies or bubbles in her uterus. What presumptive sign of pregnancy is the client describing? A, quickening, B, amenorrhea, C, Hegar sign, and D, ballottement. So if you are unsure, the question does say that it's looking for a presumptive sign of pregnancy. So we can look at the choices and eliminate things that are not presumptive. So Hegar sign we know is probable, and ballottement we know is probable. So those two answers are not correct. So A, quickening, and B, amenorrhea are both presumptive signs. Which one may cause her to feel like butterflies or bubbles in her belly? The answer is quickening, because this is probably her feeling those first fetal movements. It's presumptive because only she can feel it, but it is something she's experiencing and feeling. And that's it. Thanks for watching. Be sure to subscribe, like, and share for new videos every week about everything OB. See you soon.